And then what if you are faced with an obese child, and what are the blood tests you should do? Depending on your BMI, you should do the fasting lipid profile. You should do the blood glucose or liver function. What I do, if I find the child is obese, I do an ultrasound to show that the fat is being deposited in the liver. And then when the fat is being deposited in the liver, it's really dangerous. What is more dangerous is the alcohol or the fat to the liver? I think it's the fat which is more dangerous to the liver, and because you have the NASH and other complications. And so many complications, all of you know that, I'm not going into this, but the gallstones are important complications of this. And BMI in relations to obesity, the four major problems that we are worried is that the type 2 diabetes, cholelithiasis, coronary heart disease, and hypertension. And as I was talking, that non-alcoholic fatty liver disease found in 25% of obese children. And what I need to do is to do a ultrasound. And you can show that the grades, the first grade will be the normal architecture. The second grade will be like the liver will be like the portal veins and arteries, their echogenicity. And the third one will be like the diaphragm, where the grade 4 is the fatty liver, in which the diaphragm outline is obscure. So the liver and diaphragm look similar. So you ask the ultrasonologist, I want to know what type of fatty liver he has, because really it's dangerous. And then you know obesity is associated with polycystic ovary syndromes. I'm not going into the other problems that it can cause. The metabolic syndrome, all of you know that, and it can cause. So what you need to do the testosterone level, FSH, LH level, and also you need to do the insulin level and ultrasound to see that the ovarian cysts are there or not. And then obesity is the mortality. It has got 12 times more mortality than the non-obese children. The treatment part, I will spend little bit time. So the reason for that is that most of the obese children do not come for treatment. Even if they come for treatment, they do not get the result. Even if you get the result is not persistent. And if the result is persistent, they do not continue the treatment. So what is the point in treating them? But with all the efforts, parents sometimes cannot control the obesity with a lot of efforts from the child side, from the parent side. And here comes another gene, which is called the perilipin. This perilipin protein on the surface of the adipocytes protects these fat cells from adipolysis. So if you are carrying a perilipin gene, you will have tough time in controlling this obesity. And the benefits, you know that if you reduce the BMI, your triglyceride level will come down, your blood pressure will come down, your HDL level will improve, your LDL level might decrease. So there are a lot of advantages. And there are a lot of goals. It should be a short goal. Don't tell that a child who is 56 kg that he will have to come down to 30 kgs. It should be in steps. And it's just like when we want to be like our senior big doctors, we never want to be like a big doctors. It's step by step you go ahead. Don't try to jump, then you will have more chances of injury from falls. And the staged approach to weight management, prevention, structured weight management, comprehensive multidisciplinary evaluation, because a lot of people are to be involved in it, and tertiary care. So, nutshell, between 2 to 7 years, if your BMI is between 85th and 95th, you just try to maintain that weight. Just try to maintain that weight. Don't need to reduce it. Give them the example that if you are walking faster than your girlfriend, you don't need to walk back to catch your girlfriend. You slow down your speed. Similarly, uh, you just need to maintain the weight. If it is with complications, then you need to weight maintenance, and if it is without complications, and if it is complications, then it's the weight loss. The same is true in the next. The last part of my lecture is on sweets. We have the habit of making the children's tongue sweeter. And the earlier you make them sweet, the lifelong they will remain sweeter. So they will have more chances of taking sugars and sugars and sugars. At this point, I would like to discuss a little bit off the track, is that the paleo diet. Now what is paleo diet? The diet that our forefathers used to take. Forefather doesn't mean my grandfather or my great-great-grandfathers. It is the peoples in the Paleolithic age, what they used to take. They never used to take the milk. It's only for the 7,500 years that we are taking milk. And the nature is always very protective to the children. Nature doesn't want that we as human beings should take someone else's milk. Is the man is the only animal who takes someone else's milk. The only example you might say is the cat. Now the cat says, why should you take the milk? So he takes it away. He cannot throw it. So that's the only example that we have. And so the nature is very, very protective. You all know a small mango, it doesn't have a taste. A small guava, it doesn't have a taste. Tell me anything, it has a taste when it's a small. You might talk about baby corn, but that is a different type of baby corn. And baby corn itself is not very tasty. Nature has protected the children without giving the sex organs. So nature always protects the children. So nature can never want that we should take the milk. Standing in this forum, I can say that yes, we do need milk, because not everybody can produce breast milk to the same extent. Again, it's a gene, and it's not necessary. We don't need to take wheat. Our grandfathers, they never used to take wheat. And that's the reason you see celiac disease and all other diseases are coming. And then they never used to take sugar. And then they never used to take colors and flavors. So the paleo diet, if you follow, that will be good for health. And this is a recent scientific craze in USA and in many developed countries. So I am supposed to talk on sweets only. So I suggest that don't make the children's tongue sweeter at a very early age by giving more sucrose to it. And then the pharmacotherapy. There are a lot of drugs. Honestly speaking, nothing is really useful in children. One can talk of orlistat. Now the problem with orlistat is there is not enough long-term studies. And if you are taking orlistat, then you need to reduce your fat intake. Because if you are taking orlistat and fat, then the fat will go away. It will reduce the fat absorption by 1/3. And so what that fat will go, it will leak. And it will give a very, very unpleasant sensations and feeling and psychological disadvantage. And it's very costly. The second one is the metformin. The metformin is one of the drugs which is used because of the science behind that it can reduce fat. Metformin is also used, you might be knowing, that it's an anti-tumor effect. Those who take metformin, they have much less cancers. And that is the reason that metformin is being used, is in a trial phase still, that in tuberous sclerosis where there are a lot of tumors, and the children who are giving metformin, they are seen that they have less chances of tumor. Reduction. And I'm taking metformin for the last 25 years, and I hope I will never have a tumor. And what it does, it changes the GLUT4 receptors in the muscle cells, expressions in the muscle cells. And this GLUT4 then helps to absorb the glucose into the muscles, and the glucose level reduces, and also it decreases the appetite. The lactic acidosis that you see in adults is never seen in children. But on a short-term basis, it is okay, and most of the studies are up to 6 months to 1 year, and we don't know how much BMI it will reduce on a long-term basis. And last is the non-exercise thermogenesis, or it's called NEAT, non-activity exercise. Like, you don't need to run and jump every day. But if you do your own work yourself, you will lose a lot of energy, and that you can see that the exercise is this, and the NEAT, non-exercise activity thermogenesis, is this much calorie loss. So every patient you see go to the examination table and see there. The parents are also very happy. Parents want that their child, whether it cries or not, they should be laid on the floor, on the bed. So he didn't even lay down the child. So try to do that. And non-exercise activity thermogenesis is very, very important. You know, I have a colleague who is very fidgety. He's very fidgety, and he's very lean and thin. So if you are fidgety, if you are active, if you are running around in the world, then you will lose a lot of weight, and that might be more useful because NEAT is coming up. One of the main reasons for that is, you know, before you go for the bariatric surgery, you must give a consent. And the chances of suicide after the bariatric surgery is very high, because you cannot take, because your stomach has been reduced, your bypass has been done, you want to take it. So until and unless they are mentally prepared, you cannot do the bariatric surgery. Before 12 years, no questions. Between 12 to 18 years, you need to take a consent from the child, and there need to have a psychological support before you go for this. And that's all about obesity I can talk about. Thank you very much for your patient hearing.